I know nothing about this, about nursing home resident data, how it's used, how we gather it. So I'm going to be listening intently as well today, along with all of you. But before we move to this discussion, I'm really excited that today's discussion is a partnership with Aging in America. And we've got the founder of Aging in America, Mark Swartz. Mark, first off, thanks for bringing such a unique and interesting discussion uh, to me to partner with for our platform. I'm really looking forward to it. Before we dive in and meet our panel members, tell us a little bit about yourself and Aging in America.
Thank you, Steve. I'm Mark Swartz, and I'm a writer and editor, and I'm recently launched as publisher aginginamerica.news, and we're really addressing the care workforce and care solutions. I've written mostly about early care and education in my career, and this is new for me, this whole topic, and I love meeting people like uh, the experts on this webinar. And Eric has written a few things for Aging in America News and is really an expert on nursing home data. And I thought if he did a presentation on that, we could all learn what's going on with that. I'm adding my information in the chat, and I hope everybody goes to Aging in America News, subscribes. There's a subscribe button at the bottom, and we also have a LinkedIn group.
I love it. All right. Well, this is exciting here, and Mark, let's welcome our community to our two panel members. We've got Bob Blancato and Eric Goldwein, and I'll let you go first. Give us a little overview. I mean, I've known you for years and had the good fortune to moderate some events that you were keynote speaker and president at. But for folks that may not be familiar with your background, share a little bit of who you are.
Thank you, Steve, and it's nice to see you again. And Mark, congratulations. I enjoy your Aging in America. Try to contribute a little bit to it, and I think it's great what you're doing. Um, I do a number of things in the field of aging, but the one I think is most relevant to our conversation today is I'm the national coordinator of the bipartisan 3,000-member Elder Justice Coalition, which spends a lot of time focusing on issues around elder abuse prevention, whether it be in the home, in the community, or in nursing homes or assisted living facilities. And in that capacity, we have worked to get legislation passed, to promote certain regulations, to improve the quality of life for older adults by preventing abuse, neglect, and exploitation. And that's why today I think is very important, because the fundamental issue confronting nursing homes for years has been staffing shortages. And we were very disappointed with the actions taken by Congress earlier this year to hold back on the minimum nursing home staffing rule proposed in the previous administration. And I know that Eric has a tremendous amount of knowledge, but his major fundamental point is that data is critical in understanding staffing. I mean, work that he's done before has shown that 9 out of 10 nursing homes of the 15,000 we have are understaffed. And, the reasons are many, from high pay, high turnover, low pay, things of that nature. But to get a better grip on it, I think it's vital that we see what Eric has to say. I look forward to chatting with him, and I'll stop there.
I love it. And Eric, before I believe you've got a slide deck that you're going to share with us, but the before we do that, let's get to know you a little bit better. Tell us a little bit about your background and how you got into this unique line of work.
Thanks. So I'm Eric. It's nice to be here, and thanks for the introduction. My passion is taking complex, often boring data and making these numbers accessible and useful for the public. I spent the first part of my career in journalism and sports and health journalism, actually writing about football games, basketball games, football concussions, and there I was looking at football concussion spreadsheets, stat sheets, and I pivoted to public health, to aging, and I found myself in 2019, 2020 at a nonprofit, staring at these payroll-based journal data sets, and then soon after the COVID pandemic data. And I think that this is such rich data sets in a critical issue. And while it's in these huge data sets, spreadsheets that are difficult to download. There's takeaways when you can frame it in the right way and give it to consumers and give it to the public. And hopefully we can use this to uh, lead to better care and better policy.
Man, I love it. Well, Mark, I think this is a great opportunity for you and I to duck behind the curtain and let these two take it away, and also remind folks that you have the opportunity to ask questions, make comments, and uh, join in the conversation. So I'm gonna duck behind the curtain, and Eric, if you
Okay, great. And I just want to confirm we're looking at the right show
Yeah,
here.
make sure that you get it on that display
Do a
setting.
swap. Are
Yep,
we
there you
good?
go. Looks
All
good.
right,
Looks really good.
great, great. So we're going to do a condensed version of this, a little 10-minute talk. I'm going to get into, we'll go a little bit about me, a little bit about aging and demographic data, and then nursing home data, and then we'll open the floor. So just a quick note about me, as I mentioned before, I love data. Sometimes it relates to nursing homes, sometimes it relates to running. Sometimes that's a spreadsheet of my favorite HBO shows, but my background is economics, journalism, public health. I live in Brooklyn and I am from Philadelphia, the home of the Super Bowl champion Philadelphia Eagles. Uh, and I do love data, but I wanted just to share that data is not everything. It's one piece of the puzzle. It can tell us HPRDs and ratios and medians and all this boring stuff. But if you're in a five-star facility with a high staffing ratio, and you're talking to residents and they're like this, they're not happy, they don't feel safe, they don't feel supported, those numbers don't matter. We need to look beyond the numbers. The numbers are a piece of the puzzle, a critical piece, but I want to look beyond. And on that note, I'm going to share a video. This is of one of 1.2 million residents at one of the 15,000 nursing homes who happens to be my Uncle Mike. So let's get this in.
Free space, 27 and 9.
And that's the big song.
Thank you. This is my nephew.
Hi, I'm the good luck charm. All right. Good job, Uncle Mike.
Thank you.
Great. So again, that's just one afternoon, one Monday afternoon at one nursing home. I don't want to read too much into that. All I can say is in that room, there were a 30 or so residents. The staff knew my uncle's name, and they seemed to be in a good place. And that's just an example of good care. I can't speak beyond that. But again, there's 1.2 million people. There's millions of uh, employees and staff connected. These are people and not just spreadsheets. So we'll get back to that little bingo board later. And these are, you've seen a version of these numbers before. The bottom line is we have an aging population. 65 plus is outpacing other age groups. The 85 plus age group is projected to double in the next 15 years. We're already short on care, and the population that needs care, long-term care, is growing while the working age population is not keeping pace. Inside nursing homes, there's 1.2 million residents. That number's rising a little bit. These nursing homes are the last line of support. Meanwhile, the staff population is 80% women, half of the staff is people of color, and there is a large sector of the staff is immigrant healthcare workers. There's all sorts of studies that will basically lead to the same conclusion that more staffing is associated with better outcomes. The costs, in addition to the moral costs, these nursing home care costs roughly $108,000 per year. It's largely funded by us, the taxpayer. It's about two-thirds Medicaid, 13% Medicare, and 25% private pay. This is expensive. We conduct dollars and cents, but I would argue the costs are beyond that. Uh, so we're going to get into some of my findings about the nationwide staffing levels. The number, the national ratio is 3.73 nurse staff hours per resident per day. Now, that doesn't really mean I've been looking at these numbers for 6 years, and even I have trouble conceptualizing that, but that's equivalent to roughly one staff for every 6.4 residents. But these vary by state, by region, by facility, by shift, by floor, by side of the floor. So that's just one number. In Alaska, for example, it's 6 HPRD, whereas in Illinois, it's 3, which is closer to one staff for every 7.5 residents, whereas Alaska, it's one staff for every 4. And there's a lot of the benchmarks we see, no matter which ones we put in front of us, a lot of nursing homes are failing to meet them. The proposed and blocked federal staffing minimum of 3.5, including 0.55 RN, roughly 1 in 5 would meet all those requirements, and roughly 1 in 4 just meet the overall 4.1, and more than half of nursing homes are not meeting their case mix expected. In words, as the NASM report found in 2022, the pandemic lifted the veil and amplified the long existing shortcomings in nursing home care, such as inadequate staffing levels, and they described it as dire staffing situations for many nursing homes. Just a quick dive into what we've been seeing in the last 8, 9 years since there's been very good comprehensive data on U.S. nursing home staffing. You're going to see a little bit of a bump in 2020, 2021, and that is not because staffing increased, it's because the resident population decreased. And again, that was due to the COVID pandemic, where study after study, report after report, conversation after conversation has found that lower staffing exacerbated the impact of the COVID pandemic on the resident population. Now, again, this is the nationwide trend, but it varies by state, by region, by facility. So not every state is going to look like this graph, but this is the nationwide trends. So we're going to get to what it looks like at a typical nursing home. And then after that, we're going to open the floor back up and chat. But the typical nursing home has 3.67 HPRD, which on a Tuesday afternoon, that might look okay. That's on a 30-person floor. That's 5.5 staff. 3 aides, 2+ RN, LPN. But again, as I mentioned, these numbers vary by shift, by day, and on a Saturday overnight, that can look, I'll define as not great. On a 30-person floor, that's 3.3 staff, 2 aides, 1 RN, and LPN. I'm going to open this for you all, including the people that may have a family member in a nursing home or have spent time there. But on these overnight shifts or in these low staffing, what might that mean for residents? And Steve, if you could, if there's comments, anybody wants to chime in, we can get some of those thoughts.
Absolutely. Well, Ben has asked earlier on in the discussion, at some point, can you please indicate if you consider local Washington, D.C. metro laws and regulations, if they're adequate. I'm not sure how that relates to what you're bringing up, but I want to just make sure that we stick that in
Okay, yeah,
the files for something to
great.
comment on.
Okay. Yeah, there are different states that have minimums with varying levels of enforcement and levels. Some are at the 3.5. I'm not I have the numbers somewhere, but I don't specifically know the DC regulation. Maybe Bob has some thoughts there just about state minimums or regional in general.
I honestly don't, but we certainly can track it and try to find out and get back to the individual who asked.
Yeah, absolutely. All right. Um, uh, and okay, yeah, if you want to keep on going, let's go through
Yeah.
your data and then we'll start hitting some of these other
Great,
questions.
great, great. So yeah, this will be before we keep going, but the bottom line is this is what it looks like on a Saturday night, and I'm not this is one potential example, but the bottom line is sometimes staffing might be good, sometimes it's low, and I have this is tongue in cheek, but my tip for residents is you want to schedule your emergencies for weekday afternoons and not when there's low staffing, which of course uh, you can't predict when you're going to have an emergency. So the bottom line is facilities not only need to be staffed overall, but they need to be highly staffed every day and sufficiently staffed every shift to ensure good outcomes and to reduce the chance of poor outcomes. So let's open it back up, and then later on, I have some tools for the people in the audience to use to better understand the data and to use whether you're a family member or whether you're a resident or a provider.
Okay, great. Let's see. And while I'll let Bob, I'm really curious about your insights on a, what Eric has shared and how data relates to public policy.
Well, it should relate a lot more when you have data like that to share, and it should move the policy needle toward achieving a minimum staffing number and hours, as the Biden proposed rule tried to do. I think all you can really do is continue to provide that data, localize as much as possible, focus on the nursing homes in the important states and congressional districts where key members of Congress who determine nursing home policy are from. But there's no question that there is a vital connection between data and public policy. And this data is particularly important at this point because we have to we have to focus on both nursing home and assisted living from a long-term care perspective. And staffing is an issue in both places. And it's been there. This is not a new issue, by the way. It's been there for a number of years. But perhaps these are new findings and new data that can help move the needle a little bit more.
And let's see. Here's a couple of questions that have come in. Okay. Let's see. First off, the are we discussing the labor pool at all? It seems like care facilities don't have enough staff due to lack of caregivers in the marketplace. And Eric, I mean, I guess you're reporting on the data
Mhm.
that the nursing homes are legally required to share. But do you have any insights on labor pools and how this data relates to that?
Yeah, so more generally speaking, the demographic trends are not favorable to this situation. As I mentioned before, the 65 plus, the 85 plus is growing faster than the working population, and it's also not uniform in terms of the available pool of staff based on region, based on state. Some areas might have a more accessible pool, some areas might not. And there's systemic policy beyond nursing home, behind these data sets that, as I mentioned, data is a piece of the puzzle. And there's immigration policy, uh, there's policies that are promoting childcare that affect this. This stems much beyond the data sets that I'm bringing up, and uh, there are some cases where a nursing home might actually have the available staff and they're just deciding not to pay them. There might be others where there's real logistical challenges. It's not uniform by state, by facility, but yes, there's systemic demographic trends that are going on that are uh, complicating the picture here.
Yeah, and I think we'd also should throw in the emergence of private equity takeovers of nursing homes, and in some cases, what that's leading to relative to staffing challenges, because more and more anecdotal information comes out about private equity acquiring a nursing home primarily for the land and not caring so much about the facility, and that can lead to staffing issues as well. So there's a lot of factors, as Eric said, that go into determining the demographics, but I don't think anybody's going to say that we have an overstaffing problem.
Yeah. Now, let's see. Um, Eric, I don't want to put you on the spot, but Ken asks, are there state websites that provide this local data? But actually, this are could you share, or I could pull it up too, but the website that you created, I felt was very impressive in terms of how people can do searches on this type of data, and it's free of charge to the public. Would you like to do a quick demo of that, or
Yeah, I
is that
would.
a
I would. Of course, I would love to.
okay?
There's a number of good resources I can lead with my tool, and I also want to talk about some of the government resources that are highly effective as well. And again, I have a bias toward my own resources, but if I'm talking to my parents, I would direct them, or my family members, I would direct them to Care Compare. But we're going to start with my tool. And I'm going to share. Let's see, we are here.
Okay,
So
and then I dropped the link into chat as well.
great, great. So as I mentioned before, there is it's called the payroll-based journal data set, and this is a record of every single nursing home's data for the last 8 years, 2017 to 2025. It has every single day, every single position, every single nursing home. It's billions of cells of data. I counted, it's, I think, 46 million days when you combine every nursing home's observations. And what we have in terms of other publications is they will explain what are you doing for me lately? What is the most recent staffing data? What's the most recent ratings? And that's, to be honest, that's the most important. What have you done for me lately? But I think it's also important to note, what are the patterns? Is this facility on the rise? Is it declining? What's the story in terms of uh, what the ratings have been? And then when you connect it with the policy or the knowledge on the ground, that's when this really becomes powerful. So here is a intro to the site. Well, let's pick. We'll pick. We'll pick Pennsylvania. So this is. We're going to go to Pennsylvania, and here we can see what's been going on in Pennsylvania for the last 8 years. You can see again, this follows a similar bump as the national trend, where the ratio went up, then it started to go down after the pandemic. But again, the staffing ratio artificially went up because the census declined uh, a significant amount due to resident deaths. And in this quarter, it is actually again, this is where context really matters, but there was 1 or 2 quarters where not every facility reported PBJ data due to the stresses of the pandemic. So again, you can look at every state, you can look nationally, you can look at every facility, and then you can have takeaways. It just this is kind of I call it the PBJ bite, just the basics of the staffing rankings. You can look at how every state fares, what are their state minimum, so we can actually answer the DC question, I believe. Yeah, District of Columbia, it looks like they're, according to a MacPac report, they're between 3.5 and 4.16, depending on how you frame the data. Uh, you can also look up individual facilities. I had this pulled up earlier today. This is Joe Smith that felt like an average. I'm not. I didn't pick them specifically. I just did. It was an average name, Joe Ellen Smith. This is a Louisiana nursing home, and you can look at their staffing ratings. How have they done historically? What's happening lately? How do they compare to the rest of Louisiana? So again, 3.5, they're lower than the Louisiana state average. Here we have, I know there's a lot of, I'm throwing a lot of data at you here at once, but again, in this chart, we can look at a metric of what is their reported staffing and how does that compare to the acuity, case mix acuity metric. That is what CMS expects that they should be providing based on the resident acuity in that facility. So again, this is one of 15,000 nursing homes. That was one of 50 states we can look at and see not just what's happening today, but tie it into what happened in the past and perhaps project what might happen in the future using these data.
Hmm. Wow. This is pretty impressive that you put together this data in such a user-friendly manner, but it's also a bit scary in terms of um, some of the broad strokes that I could see on the screen there.
Mhm. Yeah, it can be some of the data can be pretty jarring.
Yeah.
There was a just here's just a use case for these data. There was a nursing home in Brooklyn in the news a few weeks ago that reported a terrible resident to resident incident that resulted in a death. And I plugged, this was a nursing home in Coney Island, 4 miles from where I live. And I plugged it into this dashboard and then into my own server. And what I found was this nursing home has been understaffed, not just every quarter, but every single day, according to the New York State minimum, which is 3.5. Every single day since that rule has been in effect, that nursing home, which is Seagate, I'm actually going to bring it up. Let's see if I can. 5513. Let's see if I remember the number. Yes, here we are. So this nursing home, it's one staffing rating, 2.88 HPRD. The bottom line is that's low, and it's been low not just every quarter, but every single day. And if you look at its reported versus its case mix, you can see that even if you're when you account for the acuity needs of the residents in that facility, it looks even more, the gap becomes even more prevalent. And again, I just to caution, I have no idea what happened with that particular incident, whether staffing at all played a role in it. It's possible that it was just things happen, but my conclusion in general is that when there is low staffing, it leaves open the door, it leaves nursing homes, it leaves residents more vulnerable for tragic incidents like the one that we read, not just in local, but in national news a couple weeks ago.
Eric, I Bob might have to jump off a little early
Mhm.
in our conversation, so I'd love to shift the dialogue to Bob a little bit in terms of, we're getting all this data here, and Eric has really compiled this very well. And Eric, I want to talk to you at some point about how we can use this data. As consumers, as advocates, as operators, or what have you. But Bob, what are some of your thoughts, and are some of your words of wisdom, how we may become better advocates uh, to make
Yeah.
the world a better place for nursing home residents?
Well, thank you for that. I mean, Eric has made a great contribution, which I think needs to be amplified in different settings. I think some of the chat comments that are coming in, I think, are interesting too. I've been looking at them as they come in. We need to also know who's getting penalized and what the penalties are for people who are not properly staffing nursing homes. That data should be made available. I imagine perhaps it is available through the Centers for Medicare and Medicaid Services, but we should be examining that and making a family decision about what nursing home, if they have to have someone be placed, to make sure it meets the standards that would be important for safety. I also think, and we touched on this a little bit earlier, we have this nursing home compare site that runs from Centers for Medicare and Medicaid Services, which is currently down to improve their data integrity, which I love that term. We all want data that's got good integrity, so that when people make a decision, if that's the site they're going to go to. I remember a situation back in maybe 2019. I'm testifying in the Senate Finance Committee on elder justice issues, and the witness before me was a woman whose mother had passed away in a nursing home from dehydration after 4 or 5 days of neglect on the part of the staff. And when she was asked, where did that nursing home rank in our nursing home compare, it came out with 5 stars. And I'm still of the belief that we need to change. If the policy still is the same, if you get graded in January and you get your stars determined by that, you shouldn't wait another year to get checked again, because the situation could change dramatically in 6 months. And we need to have some kind of a system that allows for regular monitoring of facilities to make sure they are meeting the basic criteria of conditions of participation in the Medicare and the Medicaid program. And one of the things that worries me about the shutdown that we're currently going through is, are we going to be seeing a drop off in inspections that are going on in facilities at this point in time? Are we going to have a longer delay? I mean, October 29th is when this new nursing home compare is supposed to unveil itself. Are we going to run into delays on that? So I'm giving you a roundabout answer to a pretty straightforward question, but I just want to throw some things out there that people should think about. And we're not doing enough at the federal level, at the policy level in Congress. Congress has taken elder justice and moved it back instead of forward. And it's time that we got back into the discussion about quality of care for older adults. It's about time we started more about elder abuse prevention. It's about time we strengthen the long-term care ombudsman program, which is important in reporting shortages and issues related to care. So there's a whole litany of things we could and should be doing. And that's one of the reasons why we have an advocacy group called the Elder Justice Coalition, because we're just going to keep banging on this thing until we start to see progress. But going back to Eric, his data needs to be more publicized, shared better. And I think it's great that it's been publicized in media. We should do more of that. And the last thing I'll say is that, they're also state by state have registries that you can also look at to get information. I know Arizona has at least 2 or 3. People should really do a full and detailed search if they're going to have to make that very difficult decision about putting someone in a nursing home. They should spend the time to make sure it is the highest quality possible. And let's hope we all do that. And I do apologize for having to jump a little bit early, but I appreciate this forum that you provided us, Steve and Mark and Eric. Congratulations on your work. And we'll keep in touch with each other.
Yeah.
I love it, Bob. I really appreciate your time today and your insights. And um, uh, jump off to your next meeting, and then we'll keep having a conversation here with Eric and Mark.
Okay, great.
All right. Thanks a lot. So Eric, the we're getting a lot of questions, and I knew that this would generate a lot of interesting questions from a variety of angles. The consumer, concerned about their mom and dad or their clients. But let me ask you, as you've put together this data set, uh, who are some of the users of this data? Like, uh, can you give us an idea of the folks that use this on a regular or one time basis?
Yeah, so I use it a lot. But when I think of my tool, and I'm developing different versions of it, the dashboard I'm developing is a tool more for advanced users or in people that are working or tangentially in the nursing home uh, area. So, for example, long-term care ombudsman who I've spoken to. These are especially the more experienced ones who are familiar with Care Compare and who can have the knowledge and the insights to look into the nursing home they're going to say like, hey, this is a high staff facility, has 5 stars, 4 stars. The people that have the background knowledge but want to go deeper, that's where my dashboard and my tools can really come in handy. This can be journalists, researchers, people in litigation. There's a lot of litigation in the nursing home space, abuse, neglect. A lot of these cases can be you can attribute a lot of these cases to I don't want to speak in any legal way, but understaffing plays a role in a lot of these lawsuits in nursing homes, and perhaps both directions. Perhaps a
Mhm.
facility can say, "Hey, no, we had um, 7 RNs that day, and this whatever happened here, we were there were." uh, Sufficient on the floor, and it can work in in the other direction where you can look at Thanksgiving 2022 and see 100-bed nursing home that maybe their RN wanted to spend time with their family, which is reasonable on Thanksgiving, but the facility decided not to replace their RNs because they either didn't want to or whatever reason. So it can be used in litigation, and research in a number of cases. And I saw somebody in the chat mention that there's other categories like citations. Uh, what excites me about this data set and some of the new technology and AI tools is these are messy data sets that a few years ago would have taken me and other smart people and well-intentioned people months, years to clean up. And some of the new tools out there make this a lot easier to tie these different databases together, whether it's a staffing data set and a citations data set, or whether it's a staffing data set and it's a somebody's scraping Google for news reports on Joe Smith nursing home. So that's what really excites me about the potential of this, and that I'm team data. I think when you frame the information in a way, you do it fairly, and you have uh, the right information, the right people on the ground feeding the right context, that's when you can really use data to make a difference. Again, at the ground level, whether that's better care for your uncle or at the policy level, better care for the United States long-term care system.
Love it. Um, let's see. Let's address some of these questions that are coming in. They may or may not relate directly to data, but I love hearing these insights and doing the best that we can to answer them. And Marlene says a friend was recently in a local nursing home. They posted staffing levels on a board at the entrance. I don't know if that's a Maryland law to post staffing. I was surprised that there was usually one RN for the entire facility, which was 118 beds, and often one LPN per floor with mostly GNAs. Are the staffing level, are, are staffing levels specified? And um, folks, I'm gonna copy this message along with some research I was able to do on what they're doing in Maryland in terms of posting staffing levels, which it is a law that in addition to, I guess, completing the data sets that you're
Mhm.
scraping, Eric, uh, that folks can check to see, should the facility that your mom is in be posting these levels for the public.
Yeah, so in one of the slides I had, there was a photo I took. The facilities I are required to be transparent. I think they might need a physical copy of the staffing sheet, and I think that's good. Uh, where something that I think needs to happen in the future and now is that right now the I can look through 2017 through March 31st, 2025 about what's happened each day, but I don't know what's been happening from April to October. This is an especially longer lag, but there's a 2 to 3 month lag, and it's 2025 where I can click on my phone right now and find out whether if I'm checking the stats of the Phillies game, find out whether they threw a ball or a strike or whether it was on the top left corner or the top right corner in a matter of seconds. And that data at the end of the day, I mean, I think it's important, but it's not important. And this is life or death information. And I don't necessarily think we should be getting by the second updates on it, but it should be something that's more than a piece of paper. At a facility, I think we need to be leveraging technology and the tools to get that to people.
Now, now somebody is asking, and this is I'm curious if you've done any research in this area, is the staffing numbers are troubling since many assisted livings are accepting residents that are oftentimes uh, comparable to nursing home residents, but there might not be this type of data that they're required to report, and this data is available. Um, the they just wanted to sort of bring up that insight. Have you found comparable data in any states for assisted living staffing levels?
There is not the same comprehensive data sets. I haven't looked too deeply into it. I just know that the skilled nursing facilities have much, yeah, the requirements for data transparency are a lot stricter for those facilities than assisted living, which is part of why I haven't looked in. It's more complicated you can probably piece together this state has this state has this facility, but I think again with the payroll-based journal data set, it's such a wealthy, it's such a rich source of data because it's so comprehensive and thorough.
How somebody, I remember when I first met you, I asked the same question. They're saying, I thought the staffing is self-reported to CMS. Is that still the case? And all this data that you're providing, this is self-reported data. I guess that there's legislation that they have to report and be as accurate as possible.
Yeah.
There's not a situation where somebody's coming through and doing evaluations except for on those state inspections, I imagine.
Yeah, so there's this is audited payroll-based journal data, so I it's a lot harder to fudge because it's connected to contracts. And there's audits of it. It's not going to be perfect, but it and there are for example, there was one quarter where I believe it was the administrator data. They were instead of minutes, they were recording it as hours. So a facility that reported 49 minutes of administrative, it was 49 hours, and that happened to a handful. So you'll see mistakes like that, but some of the anomalies that I have noticed in 2017, 2018, 2019 are reducing in frequency. But Yeah, so again, not perfect, but it is audited and it is connected to, and it's harder to fudge. Then it's not just a matter of the some nursing home 45 days after, or yeah, when at the deadline, they're not just submitting a random thing like, oh, we had enough RNs that day, enough PT. This is a systematic reporting system.
Now, Marlene asks, she wanted you to explain HRPD again. And
Mhm.
HRPD, I believe I got it right here. It stands for hours per resident day, correct?
Correct. Yes, and
Okay.
this is yeah.
Yeah, and just how in your world that is that sort of a primary metrics that you're utilizing?
Yeah. So this is the preferred metric of in the policy world and the research world. It's essentially saying on a given day, this is how many hours of staff a resident is going to get. I'm kind of shaking my head because like, what is it? What does 3.83 mean? Is that all CNAs? Is it uh, a lot during the day and none at night? There's so much more context that could be needed. I also think that like, I mean, in schools we do teachers to or students to teachers and I've talked to some people that prefer staff to or resident to staff, which is just a matter of divided by 24. But I think it's useful just as a again, there's billions of data points, and when you have a large enough sample, you can start to see trends. I think it's useful in that sense. But if you have a even if it's like a five-star nursing home that has a 4.5 HPRD, that looks good on paper, but there's just is or do they have high turnover? Are most of the staff unqualified nurse aides? What's it like on Saturdays? There's a lot more than that number, but I think it's useful as a catch-all and just directionally where we're going.
Now, I want to give Ken a gold star because he has really had some great inquisitive questions today. But I like this one. He says, "Do you have any thoughts about why some states have high state staff ratios? Your USA chart had some interesting distributions." And yeah, great insight, Ken. And I was wondering the same thing, Eric, because your USA chart is not just one blanket color. Do you have any insights on the different geographic regions?
Yeah. I have theories. So some of it could be demographic, some of it could be uh, acuity, some of it could be, I know smaller nursing homes tend to have better ratios. So there might be some economic or just population shifts that make, or geographical patterns that make it more likely. There's some states like Washington have a staffing standard, which I think there's some evidence that that increased it by a little bit, and there's different and there's a lot of areas, but this is where I'm gonna dodge a little because I'm looking at the spreadsheets and I what I want to happen is I want the ombudsman from Rhode Island to dive in and be like, oh, I know exactly why the nursing homes in this county are going in this direction because of this policy or this owner took over. There's a lot going on, and I have there's different theories I have, but I think when you get to the local, the regional, the hyper local expertise, and you marry that expertise with the numbers, that's when you can really start to tackle those questions.
Yeah. And we've got net I can't pronounce her name. I'm gonna call her Meta Una Newsom, who is looking into volunteering as an ombudsman. I was a volunteer ombudsman when I first got into this business, just to better understand the needs of the nursing homes. And I could see that as difficult as it is to get this data that you've gleaned, how important this could be to a volunteer ombudsman that might be visiting two or three nursing homes in their community, and the ability to just get that snapshot before they walk in the door, maybe talk to the administration about the numbers that you've put together, and then start engaging with their residents and uh um in any event. But let's see. All right. Well, holy cow. I'm looking at the clock and we have burned through an hour. Mark, any questions or insights that you might have? And then also, uh, Eric, anything that you would like to share that you didn't have the opportunity to share today?
Eric, I don't want to put you on the spot, but I was just wondering, as you were talking, how ratios compare in other advanced countries, if you have any idea if
I don't. I have some idea, but it's not on the top of my mind. I don't think we do the best job compared to other countries, but yeah, I don't have that answer. And also like the ratios, there's cultural aspects and like yeah, I don't know other than even if it's USA is 3.73 and other country is 3.2, that doesn't necessarily mean USA is better or worse. I just don't want to speak to that.
makes sense.
Um,
I just real quick, I just want to give I have a screen with some action, turning data into action that I think could be helpful for consumers and for people with family in nursing homes. Again, this data can be a weapon. Current slide, and I'm going to mess this up. Do we have the right one or the wrong one? Do I need to swap?
Turning data into action.
Yeah,
Yeah, yeah,
and
you
it's on
got it.
the okay. Great. So again, if you have these numbers at your fingertips, which I'll try to get a version of this to everybody. You can use these data. Say you're on a tour and you see a lot of staff, but the Care Compare page shows weekend staffing is only 2.7 and it's 4.1 overall. Again, you can arm yourself with this information and then ask the administrator about the weekend staffing gaps and how it'll be covered. Say you're at mom's nursing home and the staffing looks stable. It has a 5 CMS rating, but you notice it's not quite what it was before. And you can look at the dashboard and see that it's dropped in the recent quarter. And you also heard something about an ownership change. Again, this is information that you can bring and use it to show that you're informed. You are following what's going on, and ultimately you can bring that, and maybe it'll result in Medicare, maybe you can bring it to the ombudsman. But again, information is power. Then lastly, with some of the more advanced tools, you can look at what happened on a given day. So we can look back at Thanksgiving of 2024, and you remember it was just a terrible situation. There was no RNs. You can actually look at the data and you can see that, and you can use that information to be like, hey, I want to make sure Thanksgiving, Christmas, New Year's that you have an RN in because I know last year there was nobody in there. So again, these are just a few ways to use the data and put it into action and hopefully have it lead to better care. And just back to bingo, I love data, and I think it should be used. We should look at staffing. We should look at turnover, HPRD, median, standard deviation. That's all interesting to me. But also look, listen, and smell is probably the best advice. Is the food hot? Is it too cold? Is it too hot? Does it pass the smell test? Does it pass the Google test? Uh, it's important to look beyond the data.
I love I love this. And one thing, I'll throw in some words of wisdom that I share with folks. And if people are listening to this now or the recording as a consumer and you're concerned about your mom and dad or your next door neighbor in a nursing home or any community for that matter, part of this is I draw the comparison to raising children. When we have children, we don't just drop our kids off at a school. we get to know their teachers, we join the PTA, we become part of that school community. And one of the secrets to elevating the care of the people that we know and love is to become a part of their community. Volunteer, ask questions, get to know the team members that are there. This, and this is great for your loved ones, but it's great for all the countless amount of people that live in these settings that don't have visitors and don't have family. It's just heartbreaking that if you spend time in these uh communities and seeing the amount of people that may not have a visitor all year long. It may be like the one time a year that a friend or neighbor flies into town or something like that. So um uh this has really been an interesting conversation. Mark, I'm charged up to do more of these with you on a variety of topics, and I'm really excited about aging in America and your venture.
Thank you, Steve and Eric. That was great, and we'll connect more about the next one.
Yeah. So thanks a lot. And folks, don't worry, I'll get this recording up. I'll have contact info for Eric and Mark, and you can reach out to them. And as always, feel free to reach out to me as well if you've got any ideas, insights, or challenges that you're looking for solutions. But this has really been a thought-provoking uh, discussion for me, and I'm super excited that I've got access to your data there, Eric. I really thank you for all the time and energy that you put into that.
Appreciate y'all.
All right. Everybody have a great weekend. It
Have
is
a good weekend.
Friday, so can't believe we burned through another week.